Hi guys, it's Teeny, and guess what?
What?
Today I will be telling you guys everything you need to know about the COVID-19 antigen test. So you guys can check out the timestamps in the description box that I have provided for your convenience. But you can also watch the entire video for your own knowledge. So what is an antigen test kit? So when you're testing for COVID-19, there are commonly two types of tests. One's a PCR test, also called a diagnostic test or molecular test. These can help diagnose COVID-19 by detecting the genetic material of the coronavirus. And the PCR tests are considered the gold standard for diagnosis by the CDC. The second type are the antigen tests, which is what we will be focusing on today. These help diagnose COVID-19 by searching for a certain type of molecules found on the surface of the SARS-CoV-2 virus. The antigen tests are obviously not as accurate as the PCR tests, but they are a beneficial alternative to knowing the results in a quicker and cheaper manner, and it doesn't require a lab or specialist. So understanding the different types of swabs, commonly there are three types. The nasal swabs, which is just swabbing the nasal walls of your nostrils. Nasopharyngeal swabs, which requires you to go in a little deeper inside the nasal cavity. And oropharyngeal swabs, which is basically the back of your throat. Samples pulled from deeper in the nasal pharynx have been proven to have a higher viral concentration. With that being said, nasopharyngeal swab has been the standard for reliable testing. However, it also depends on the patient. The nasal and the throat swabs are much more comfortable to do, and they are also a safer method for patients with nasal conditions such as chronic nosebleeds and nasal polyps. So if anyone is suffering from these conditions, it might be best if you talk to your provider for the sample type that best meets your needs. But really, the nasopharyngeal samples should be the primary method of collection. So today I have with me two types of the antigen test kits, which are the nasopharyngeal swabs, and the home kits, which are the plain nasal swabs. So I'll be taking you guys through every step of the process. Okay, let's get into the demo. First, you're gonna wanna prepare yourself. First off, before testing, you would wanna familiarize yourself with the manual given in the box. So like these, it's also essential that you check the expiry dates on your kits, like that, like this, and like this. The content of the kits may vary from brand to brand. Some brands give you a separate buffer solution in a bottle. Some brands just have them in the tube ready for you. Make sure to read your manual if you have those extra steps. Hygiene preparation. You obviously want to do this as hygienically as possible. So whether you're doing this for someone else or you're doing this on yourself. So we're gonna wash our hands and make sure that our testing area is clean and ready to go. Now, if you're doing this on other people, it would be a good idea to protect yourself as well as protect them. So you would want to wear gloves and masks and any other protection you might have with you. I'm gonna wear gloves too, but I'm doing it on myself. So starting with the nasopharyngeal swabs, I have with me the SD biosensor and the Humasys, and I will make sure to demonstrate these side by side. So first, you're gonna remove the swab from the plastic by holding the end of the swab. So I'm gonna like that. I've done this on other people before, but I've never done it on myself, so I'm kind of nervous. So like I mentioned before, the nasopharyngeal swab is gonna be inserted quite deep into my nostrils. But before I do that, I can kind of estimate how deep I'm gonna go in by lining it with the side of my face and approximating it to around my ear, like that. So tilting my head backwards around 45 to 70 degrees. I'm going to carefully insert the swab into my nose in a straight direction. Don't point up, don't point down, just go straight, like parallel in with your nose. Oh my god. Oh my god. And then you spin. You're gonna do it on the other side as well. This is normal, guys. So now I have my tube here with the buffer solution, and then I'm just gonna open it, submerge the swab inside. I'm still tearing up. And then rotate it for like 5 times. 1, 2, 3, 4, 5. And then while removing the swab, I'm gonna squeeze to extract all the juice from it, like that. And then you dispose this and you keep this. Using the nozzle they gave you, close the top part like that. Yep. So now that we have this nice mixture, I'm gonna drop the mixture into this well right here. For around 3 to 4 drops. 1, 2, 3, 4. Place it on a flat surface and wait around 15 minutes before reading your results. You should probably not read before because it could give you false results. So wait 15 minutes. So while waiting for the results for my nasopharyngeal swabs, I'm gonna quickly demonstrate you guys how to do the nasal swabs. And you guys can go ahead and skip to the interpretation part of the video, but again, this is all for your knowledge, so you can keep watching. This one is from the Shenzhen Kiss Health Biotechnology, and it looks like that. So essentially, you just follow the same steps that you would with the nasopharyngeal swabs. So in terms of like hygiene conduct and preparation and results interpretation, they're pretty much the same, but the swabbing part is just gonna be like less teary and sneezy. So in here they gave a solution and a tube. So open this like that and then fill the tube. You're gonna empty the entire thing like that into the tube like this. I'm gonna remove this like I would with a nasopharyngeal swab. As you can see, the bud is bigger than on the nasopharyngeal swab. That's because it's going in a shorter distance inside your nose, so it's gonna need a bigger bud to absorb those fluids. I'm gonna insert this into my nose for about like 1.5 to 2.5 centimeters, and you're gonna feel like a slight resistance, and then I'm gonna rotate the swabs like 5 times. So, like that. 1, 2, I don't like it. 3, 4, 5. I don't like it. Oh. And then repeat on the other side. Why am I like this? Okay. 1, 2, 3, 4, 5. There we go. Now with the swab, same drill, submerge and then rotate 10 times while just squeezing the juice. 3, 4, 5, 6, 7, 8, 9, 10. Squeeze it out like that. Dispose. Close the tube with the nozzle cap like this. Now we got our fancy kit here, so same drill, we're gonna drop it in here. 3 drops, 90 degrees. 1, 2, 3. And then leaving it flat for 15 minutes.
15 minutes later.
So these are gonna tell you how to interpret your results. C stands for control line and T stands for test line. If there are 2 lines, one on C and one on T, it means positive, which means you are likely to be infected with the virus. But if you see one line and it's on the C control line, then it means negative. So which means you probably are not infected. And if there is one line, but it's over T, which is the test line, it means the results are invalid. Same goes with no lines at all, invalid. So in that case, you're gonna have to take a retest. And it is essential that you guys don't reuse the same kit. You guys are going to have to open up a new kit. It is also essential that you guys know that these tests are not 100% accurate, but it's still a pretty good indication. And this is definitely not as accurate as PCR testing. So if you guys are unsure, or if you guys tested negative, but you are an individual who has been exposed or at risk, or if you guys are showing symptoms that are, suspicious, you guys might want to go take a PCR test at the hospital to confirm. So it's been 15 minutes and my results are out. And here they are. Ta-da! With the information I just told you guys can probably tell that I tested negative. So I am very likely to not be infected, and I haven't been showing any symptoms of COVID-19. I have not left the house for so long, and my family, they haven't been anywhere too, so I think I'm pretty safe. Now on to disposal guidance. You guys would want to label your trash as medical trash once you guys have finished testing. If it's possible, you guys would want to put it in 2 layers and make sure that your trash bags are strong enough to not, like leak or tear. It preferably in a red biohazard bag. That would be awesome. You guys would want to label caution, contains medical waste, maybe biohazardous, something like that. So brand comparison, all 3 were great, and all 3 gave me a really nice experience of swabbing, and the kits were super easy to use. The manuals were easy to follow and everything. Very comprehensible. So if you are suspecting yourself or your family members of having COVID-19 and you don't want to rush over to the hospital right away, you can take these tests. They are super easy to follow, and So what do you do if you test positive? Don't freak out just yet. I know it can be scary. So these are the numbers that you can dial to tell them about your situation, and then they will help you out. Or just call any number that you know you need to. And here are just some things that you should probably do while waiting to go to the hospital. So you would want to go into isolation right away and try not to interact with anyone. Just stay in your room alone. Strictly wear a mask and try not to share any items or food with anyone else. Wash your hands religiously and carry a hand sanitizer. But most importantly is to stay calm and take good care of yourself. Make sure you eat nutritiously and give a lot of importance to fruits and vegetables with high vitamin C. And final words. So if you tested negative, then good for you, but still, do not let your guards down. Take good care of yourself. It's important that you stay strong and healthy during this difficult time. So wear your mask, practice social distancing, limit social interactions, and try to stay home if possible. This way, you're protecting not only yourself, but other people as well. Healthcare professionals are risking their lives out there to protect us, so please do your part to stop the spread. You can check out the description box, as I have provided you with informative and trusted sources that you can learn more about COVID and the antigen test and keep you updated with the situation. If you do notice that you're feeling unwell or you suspect yourself of having the COVID-19, you can get tested by using these kits first. Although they're not gonna catch every single COVID case, they could catch at least some cases that would have otherwise gone unnoticed. And that's it for this video. I hope you guys found it helpful and informative. And if you did, don't forget to hit that like button, comment down below if you have any questions, and subscribe to my channel to not miss out. And also don't forget to hit the bell icon to know when I post. And you can also find me on my Instagram. And that's it for this video. Stay safe and take care, guys. Thank you so much for watching, and I will see you in my next video. Bye.